there is so much information out there on all digital channels about those weight loss agents that is all the rave now, right?
Yep.
People losing weight and they're all bad or they're good or the Ozempic pace. But the bottom line is we are seeing a ton of really good, at least benefits. Overall, you hear people
Yes.
feel better, they lose weight, they hear it, in social circles
Their blood
and
pressures are
yeah.
down. Their insulin function is improving.
And so, what we did is, after we hear these stories, look at some of the studies about inflammation in GLP-1s. And what we found is actually very interesting. So, 69% of the studies that are reviewed have a positive influence on decreasing inflammation. 9 papers actually show that it decreases inflammation.
So that is so eye-opening because we hear our patients say, I feel so much better.
Mhm.
I'm doing so much better. And you think, well, with the weight off, their joints don't hurt so much. Their metabolic function has improved. So that's why. But how much of it is actually that inflammatory those markers being affected as well?
But like CRP, for instance, the
Yep.
C-reactive protein, that's one that they commonly will look at. So those inflammatory markers, but a lot of people will follow the CRP as a level of inflammation and will look for things that will reduce it. So obviously there's things you can do yourself to reduce inflammation, but it's huge that this medication peptide that you are using not only is going to result in weight loss, but have other pleomorphic positive effects in the body. It also showed just from a overall chronic disease that, diabetic markers, obviously the inflammatory markers in a type 2 diabetic are decreased. So is the insulin sensitivity. When you look at heart disease, it actually decreases, again, inflammation related to heart failure. So as we get older, our hormones decline, and most of the time, inflammation in the body is increasing. So, if you can decrease weight and decrease inflammation with these, and these are just studies we're reviewing that are pretty eye-opening and significant. Yeah, and one size does not fit all, and that's
Yeah.
frequently what you get with a conventional, let's say, one injection. So it's good to be able to adjust the dose and customize it to a patient. But just all very interesting conversations, well worth having.